Well, this is my fellow grand rounds, and I'm going to take a stab at talking about artificial intelligence and infectious diseases. Obviously, has grown in popularity recently with the new application ChatGPT. Everyone's talking about artificial intelligence now. People are using them to write their own papers. Maybe we'll be able to use them to write our own notes eventually. And we'll talk about that. so, so I wanted to see the application in infectious disease and medicine in general, and kind of went over a few applications out there that are being currently used. Okay, so I'm going to start by talking about artificial intelligence and infectious disease surveillance. And you'd be surprised that it's already been in use for like a decade. So early warning systems. Early warning systems basically are used for disease surveillance, and they've benefited a lot from AI algorithms and analytics. One of those applications is called Healthmap. Healthmap has been in use for over a decade. It can go through all the communication on the internet, can go through social media, and basically take words, pathogens, and geography, a number of cases, and put it together, and gives you an early warning if there's an outbreak of an infectious disease somewhere in the world. It can basically give you the first reports of an emerging virus or pandemic. And obviously it has an advantage over personal people doing it, because it can go through a wide range of information out there that would be very labor intensive for people to do. It uses natural language processing, basically to go through the web and looks for signals for infectious diseases. This is kind of an example where it's just scouring the internet and it sees this post and basically grabs coronavirus, Seattle, Washington, number cases 6, puts that on. And from there, it will do that everywhere else and kind of tells you if there's some kind of an outbreak of infectious disease coming on. It's said that it's provided early evidence of the emergence of H1N1 in Mexico. It was used to track 2019 vaping pulmonary disease, induced pulmonary disease in the United States. It's also enabled in December 30th it gave a warning about a cluster of pneumonia cases of unknown etiology, and that was COVID-19 pandemic. So it kind of can sound the alarm faster and earlier than what if humans on their own are doing that. Another application of the same would be pathogen classification, and this is the Kirby-Bauer diffusion test. We know about it, where it's a simple low-cost test, and you measure the zone of inhibition and you determine if this pathogen is resistant or not. State-of-the-art laboratories have automated this process. They will put the petri dish in an automated process and find if an organism is resistant or not, but that's not available for everyone. So what about source limited settings where this might not be? It's going to have to be user dependent, and that's kind of the downside with this, that it's user dependent. So a group of researchers came up with an app, and it can be used offline. It can be used, like I said, in resource dependent settings where they might not have an automated process to do this. And you basically put in, like you see the diagram, the petri dish is right there, and you put your phone above that, and you just put it in the circle, you put what antibiotic it is, and it will tell you, and take the human factor out of it, and it will tell you if it's resistant to that specific antibiotic or not. And if it detects a drug-resistant organism or a carbapenem resistant or something, it might also notify WHO or whatever surveillance is in that place. And this is really aimed at laboratories that don't have a lot of automated processes. So it's an offline application that lab tech could basically use on their phone, and gives you a reliable method to measure this. And it does use artificial intelligence in determining like what kind of if this is resistant or not, and if it's zone of inhibition, what it determines, and what kind of even treatment it can suggest. It's also been used in source identification. So after detecting, hey, there's an outbreak out there, you'd want to find out the source and kind of try to mitigate those risks and maybe stop the spread. This enhanced detection system for healthcare associated transmission has basically, it's a group of researchers out of the University of Pittsburgh, and they use machine learning to detect outbreaks within a hospital. The way it does, it's linked to the EMR system, and it's able to detect, okay, there's a case of MRSA here, a case of MRSA there, and are they related or not? Is there an outbreak in the hospital, or what could be the source of transmission? This is very beneficial for infection prevention. And examples for this in real life. It's basically, it was implemented in the hospital and it identified multiple outbreaks that would have gone undetected. There were 2 patients with MRSA infections in 2 different hospital units. They had positive cultures 8 days apart. So a regular IT person would have missed it, wouldn't have thought that these 2 cases are related anyway. But through scanning AMR, this application was able to determine that these 2 patients had an EEG by the same tech on the same day, and basically traced back that EEG probe or whatever that it would cause this MRSA basically to be spread to these 2 patients, even though it was identified days apart, but it had happened on the same day and by the same tech, bedside EEG. So that way you can basically do deep cleaning and for that kind of probe, or maybe take it out of use. It also detected a Pseudomonas outbreak in 6 patients over a period of 7 months. Again, 7 months, people getting to it might not think that these are related, but it was able to detect that all these patients had the same gastroscope used. So those kind of like this implementation in practice and in infection prevention would be very useful. And it basically will surpass what a regular, like if a human is trying to do this. Risk assessment. So this was a lot of times used in the COVID pandemic, and risk assessment is basically when you have an application or a chat bot or a voice bot talk to you and kind of determine what are your risks for having COVID-19, for example. And that was used to determine if a patient needs to be tested, needs to be quarantined or not. Again, humans can do it, but with artificial intelligence can kind of streamline this process and be done with a lot of patients and really determine. So Greece used this. It introduced a program called EVA, which is an AI algorithm to screen travel for COVID-19 at the border of the country. And this basically determined if patients need a PCR test or not. And at that time, Greece had limited PCR testing capabilities. So they really wanted to test the highest risk patients. And they do say that this algorithm identified like almost 1.5 times as many asymptomatic infected travelers as usual epidemiologic metrics that you would have used in case someone coming from that area, I'm going to test them or not. The algorithm was just more robust. And this is kind of an example here. And it basically looked at the origin, the demographic information. You had to fill up a questionnaire, your time of entry, and it determined if you're low risk, high risk, or low information provided enough information. If you were low risk, you didn't get tested. High risk got tested, and the low information one was dependent on PCR ability. So if you have, and it basically adapted to how much PCR testing. So the more PCR tests you had in the country, then it would have lower threshold to test them. But if you had limited supply that has a higher threshold, then it will only test the very high risk patients. So this was an application in real world and benefited them in allocating their PCR testing capabilities, really. So this is this is a diagram of other stuff like comparing AI and real world practice. Really looked at, for example, future indications like biosignals measured by a smartwatch. Imagine your smartwatch you have on, a lot of us wear them, and it starts to detect increased heart rate or something like that in a group of people in the same area. That could be an early sign of an outbreak. Cough, it's like our smartwatches are able to do the same thing. And if you have like all of a sudden you have an area of the country or area of the city that's having increased signals for coughing that could be a spike in symptoms for COVID or otherwise. AI algorithms can go over internet searches, queries for viral testing sites. Where a lot of people are searching for, I want to get tested, I want to get tested. That's an indication that a lot of people are symptomatic in that area, to determine using IP addresses. Basically, all of this is to try to surveil, try to tell us this area of the country might have an outbreak of a certain disease. Other examples, test positivity. Obviously, that is used a lot to determine like how many positive tests in a certain place and tell us if it's kind of could be an indication that there is an outbreak there, that it's not controlled. Maybe people are not implementing preventative techniques well in that area. Posts on social media. People even say mask wearing captured by CCTV, so if you can have some of these, there are also images and see how many people are actually mask wearing, adhering to mask wearing in a certain area. All of this data can help us basically determine where mask wearing people need to implement more education in that area. People are not wearing a lot of masks or stuff like that. So this is like a few good examples of infection surveillance and artificial intelligence being employed in that area. Voice recognition technology is again used in medicine as well. Even all of us are actually using it.
Amro, sorry.
Yeah.
For the what you were talking about when the smartwatch can detect certain signals, is that just a theory, or was it there's like studies that
This is kind of a theorized that this could be used in application in the future, that if it's detecting a lot of people with increased heart rate in that area, and this data is all being pulled somewhere, that this can be used later on to detect an indication of possible outbreak. So voice recognition, it's cutting edge development really in the field of artificial intelligence. There's a lot of artificial intelligence powered apps now that are doing verbal communication between them and patients. Interfaces are using voice assistants like Siri, Amazon, Alexa. All of these are examples of artificial intelligence. They're able to talk, to answer questions. They're not as, I guess, smart or robust as ChatGPT, but it is an earlier version of artificial intelligence. And can we employ this in practice? So one app tried to do that, or is doing that. CardioCube is the name of the app. What CardioCube does, it basically collects patient-reported outcomes and biometric data. So it will go ahead and it's targeted for heart failure patients, actually. That's what's called CardioCube. And it will go ahead and ask them, it will have a questionnaire out there. It will ask them the questions of, can you measure your blood pressure? So the patient will go ahead and measure their blood pressure. It will get the reading. Are you having this, are you having like all the symptoms of heart failure? It will calculate a CHA2DS score. And it's able to do that. And then after it does that algorithm, and you have something like an Alexa or a Siri or something talking to you back and forth with the patient, does the whole thing, does the questionnaire, and then it reports this to a physician if there's alarming signs, someone with a higher score. And these patients will end up needing to be seen. So it's kind of like a filtering method for those kind of things. And the other patients who are stable, their symptoms are controlled through the questionnaire. Maybe they don't need to be seen frequently. And this is like a nurse. This is like, yeah, it's basically like a nurse triaging. It's just talking with the patient prior to their visits. And this is actually employed in real practice. And this is like what they have on, like in the past week, have you missed any doses, any refills required? It will ask them about their blood sugar, blood pressure, glucometer. This is actually for diabetes. And it will check the blood sugar levels, and then it will take all this data, give them a score, and see how often do they need to be seen. And if someone is really having like a lot of, basically missing a lot of medication, their blood sugar is way out of control, then that would be like an alarming sign. It will send it to the doctor that this patient might need to be seen within a week or two. So yeah, this is kind of one way to do this that could be interesting. Okay, next. Okay, Dragon Medical one. I guess we're all using this, right? It is AI, believe it or not. It's not only voice recognition. This is cloud-based. There's a cloud-based, basically, that's being updated at all times with new words. That's why it's able to even understand new medications like cancer treatments. And when you're able to dictate you see that it's able to detect that. It also detects your accent and calibrates to it, and that's why it's way better than your basic voice recognition on your phone or other stuff. And it's completely cloud-based, and it obviously helps a lot of physicians cut documentation time. I'm not sure how many people are using it here. I'm using it too. Yeah, so I suggest you start using it, because once you get good with it as well, it becomes really fast. It's really good at detecting like everything basically, but there's more advancement that's coming up in that area. And this is the Dragon ambient experience. And my understanding, actually, where I'm going, they were rolling that out in clinics. So what does that do? It's AI-powered, voice-enabled, and ambient. So it will basically, you have an app, and this is mainly based on clinic visits, where you're going to turn on your app, and then you're going to talk to the patient. And you'll be like, hey, how are you doing today? Did you get your medications? Did you miss anything? Are you having any cough, shortness of breath? Okay, I'm going to review your medication. I'm going to do this. Then it will take all this information, write your note, available for signature. It's supposed to be pretty cool.
When?
This is out, and like when I interviewed where I'm going, they were rolling it out as a testing phase. So I might have it, so might not, depending on the testing.
2 weeks ago. I don't know if they have this Dragon, but they have a similar software where she goes in with her phone, she puts on like a microphone, and during the interview, she's like talking out loud, so it can all be recorded.
Yeah.
And then, but there's a person that goes through the transcript and puts her note together. So I know that's already available. I don't know.
Yeah, and this is what supposedly will replace scribes. Yes, it's supposed to replace scribes, so you're able to. So
Scribes.
yeah, people who make money. There are scribes out there, I guess. I've never used them, obviously, but I think it's a job out there.
Emergency room.
I've seen them.
Yeah.
Privates and emergency.
Yeah, I mean, this is kind of the downside, right? Like it takes away those kind of jobs for maybe college students who are trying to get it some experience. Yeah. But I think it's pretty cool. And if you can just talk to the patient, I'm guessing there will be a learning curve to how you're going to talk to the patient to get the note written, right? But once you get that done, and maybe instead of 10 minutes with the patient, 10 minutes on the note, you can just spend 15 minutes with the patient.
Well, what if the patient is like cursing at you or not?
I'm hoping it's going to detect that.
Put an exclamation mark and sign it.
I think the AI can take that out, maybe even respond for you. Excuse me, just talk to my physician like that.
Don't come on my robot like that.
Yeah. Or it's
I
master.
think Jessica just brought up a good point,
They're gonna
like
use
the translation.
The piss out of you, and I mean, for one, and for two, I mean, what about all your patients that don't speak English?
Yeah.
Translation would be really
Yeah, there's definitely bursts. Obviously,
Yeah.
it's very important before you go in. You know, a lot of patients, they have mental health comorbidities, paranoia,
Oh, yeah.
you don't want to,
Well,
Yeah.
that's the thing, if there's
Especially
like
on
a video camera and you have somebody who's psychotic, like for instance, we have a patient that started yelling at one of the physicians after they got out of surgery saying, "You raped me." So now you've got a voice recording saying, you raped me, that's being recorded and saved, that doesn't have video evidence of what's going on in the room. Like, that's a huge problem.
I mean, yeah.
clinical judgment. It's nice to decide where and how to use.
Yeah, I mean, maybe you use them with the patients that are like normal. Like you don't need to turn it on for the other kind of. Maybe you need verbal consent. Maybe you have an ability to kind of take some of the recording down.
You do need to keep in mind two-party states too. Not every state is a one-party state for recording. You have to make sure you warn the patient.
This is a two-party. Yeah. Okay. Yeah. I'm guessing. I don't know if Kansas is a two-party state to find out. But yeah, if they were testing it, it might not be there. But I'm looking forward to it. So, like I said, it generates notes through brief quality review, and then it delivers it to the clinician for signature. And it over time learns your pattern of each provider, how do you conduct your visit to make it even faster. Pretty cool. This is Dragon Ambient Experience Express. So when they add an Express to it, it's an upgrade. So this, yeah. So this is going to employ OpenAI's GPT-4. So the artificial intelligence here that's going to be combined with the Dragon Ambient Experience with GPT, which is, I mean, I guess the hot thing on artificial intelligence. This is still being rolled out, so this is not out for use yet. But I think this would be pretty good. And it's not only about writing notes. Like it might become that you're able to tell it stuff like order this or do this. You're just voice commanding everything if it's linked to your EMR, and hopefully make your lives a little easier. So ChatGPT, I mean, it really was rolled out by OpenAI in November 2022. There's GPT 3.5 and then 4. 4 is like the upgraded version. And it's a large language model, and it was fine-tuned using supervised reinforcement learning techniques, whatever that means. But so it's really been out there. Has anyone used it here? Yeah.
Is what you can do with it is pretty impressive.
Yes.
You can tell it to, you can actually say, write a consult and give it information. You can list some clinical parameters and say, what is the likely differential diagnosis here? And it will spell it out. You can use it to write patient letters, write me a patient letter about these test results, and it'll write a patient letter. So
yeah,
it's
You
to try.
can do it in another language.
It's very impressive. It's instantaneous. Medical wise, you can ask it to do things and it will spell it out right away. It can give you differential diagnosis of things. Might replace you. Will very soon. But it might replace us. I don't think so, but I think it might be a tool for us in the future. But it's pretty cool. I've been using it through an app called Genie on my iPhone. It has GPT 3.5 and 4, and 3.5 is actually faster, but 4 is kind of more accurate. And it's just unbelievable. You can ask it anything. And medical-wise, you can write letters, give you differential diagnosis, give you guideline treatments for things. But otherwise, you can ask it to do anything, and it can do it for you. It can write in Arabic if you want.
However, it does make things up because I used it to try to make a presentation. And it's not this one. My other one, the coronavirus, I was like, give me like the details for like MERS, and one AI model like gave me like, oh, it was like a endemic, but I like searched it up and that wasn't true. So it makes up stuff as well. So you be careful about that.
Yeah, that's the cool thing about it. I mean, the stuff that it brings is basically original. It's not like when you have Google where it's just links to things. It has original. This will answer you, but it does make mistakes. And the experts in different fields did see that it makes mistakes. And I've actually tried it out on my app here. And I just asked it, what workup should I do for cavitary pneumonia in a 50-year-old patient? And I mean, this is pretty small, but it basically says CBC, sputum, X-ray, CT, BAL, atypical pathogens, all that stuff. I tried cardiac implantable electronic device infection. It went ahead and told me that IDSA recommends device to be removed in all cases unless it carries significant risk for the patient, and you should consult an infectious disease physician. I tried the Hep C treatment. This is instantaneous on my phone, and actually the Hep C treatment was pretty good. Like direct acting antivirals, it's going to be 8 to 12 weeks. It depends on genotype. We're talking about, and the goal is to get 8 to 12 weeks sustained virologic response. They imagine if you're a patient too, like this is for us in the present, but if you're a patient, you have this on your phone and you're like, how can I get this treated? And you can compare it with the physician.
Yeah.
So imagine, Google it. This is a whole different level.
Dr. Hanley wrote an article that said that they prefer, patients prefer AI communication to an actual doctor. Concerning. Especially if they're telling you to remove your device under all circumstances.
Yeah. And then I went and asked so this is the GPT 3.5. 4 is an upgraded version of it. It's slower. So it took 60 seconds to kind of give you the answer. But look at how detailed this is. This is the same cavitary pneumonia in a 50-year-old patient. So it goes here, it's like, I'm not a doctor, but I can give you some general information. And 1, 2, 3, 4, 5, 6. 1 is history, focusing on smoking, occupation exposure, travel, physical exam, focusing on lungs and signs of systemic infection. Then on labs, it goes ahead and tells you about sputum, gram stain and culture, serology, TB testing, quantiferon, BAL, HIV testing. So, and then at the end, it will obviously tell you consult a specialist. It should be an infectious disease, pulmonology, or thoracic surgeon might be necessary. Then I went ahead and just told it, okay, what if this patient also has AML? And I wanted to see that kind of, so what if the patient has acute AML as well? Then it changes its response a little bit. So the same information, but here it added an immunocompromised panel for viral and fungal. It added galactomannan, beta-glucan antigen testing that was able to detect, hey, AML patients are immunocompromised. You should put fungal etiology high up on the thing, and you should be considering stuff like galactomannan, beta-glucan. So I think that's pretty cool.
How much longer do we have our jobs?
Yeah.
Yes. Dr. Ayler has everything.
Yeah, you know, just to kind of break this down too, and Amro, you've done a great job explaining it. But ChatGPT, what you can think about that is it's a virtual assistant that's been trained to write naturally like a human being. So that's the GPT part. It stands for generative pre-trained transformer. So it's pre-trained by examining everything on the internet, and it transforms that information into natural human language. So that's kind of the breakthrough. It can write like, you know, you ask Siri, for example, stuff all the time.
Mm.
It gives you a brief answer. But ChatGPT, it actually writes a much longer answer based on information it pulls from the internet and writing like a human being. And I think that's, you know, as Dr. Hanley writes, that's what patients like. They like the fact that this device, this artificial intelligence, can put things in a simple way that they can understand. But my personal experience with it, it's not up to date. So a lot of times the information derived from the internet is a little bit more basic. It doesn't always give you detailed answers. And also, you know, the whole concept of input equals output. You need to train yourself to be able to give it the information that it needs to give you a detailed answer. So part of using ChatGPT is just becoming comfortable with knowing what you want to put into it to give it the data it needs to give you the answer that you want. So it's really fun to work with, and I would encourage everybody to try it out. It really is kind of the next phase. And it's not going to replace us as physicians, I feel, but 5 years from now, if you're a physician who knows how to use it and you can kind of use it as an aid, then you're going to be better off than the person who doesn't use it. And you're going to have that edge. So I personally feel it's not going to replace us. We're still going to be around.
Yeah, I don't think it's going to replace us yet, at least not in the next 5, 10, 15 years. It still makes mistakes. It's still, you still need someone to see the patient in some regard, unless robots become mainstream. But at the same time, yes, I do believe it's going to be an aid. Like very soon, in a few years, you're going to be using this more than up to date. This will be the way you're just using it to get information quickly. This is on your phone. It's instantaneous answers. Maybe to even morph. And like I said, like between GPT 3.5 to 4, this is the answer 4 gave me, and the answer for the 3.5 it was totally different. Like the other one was much shorter, and this is just an upgraded version. And look at how much they were able to do in a few months by fine-tuning it. Imagine if they keep fine-tuning AI even more.
And Microsoft invested like $10 billion in OpenAI that makes ChatGPT.
Yeah.
So Microsoft's going big into this technology, hoping to integrate it into their suite of applications. And I guess they have some affiliation with Nuance that makes Dragons. So you're going to see a lot more of this technology.
Yeah, and I think they're rolling it out in their Bing search, right, as well. So they're trying to, yeah, so their Bing search will be using GPT now, and they're trying to compete with Google, obviously.
And Google has I don't know if you're going to talk about this, has a similar assistant called Bard that's not exactly identical to ChatGPT. They want to be in this technology too.
Who launched ChatGPT?
Yeah.
Was it like
Open AI.
OpenAI?
It's a separate company.
Has anybody commented on how this may or may not contribute to now excessive unnecessary testing? Because now they have this, oh, how do I work up pneumonia? And now the patient's like, but I also need this, and I also need this, and I also need this, and I also need this. How do they, now that they have this technology, how are we going to waste a lot of time either doing stuff that we wouldn't normally do because we would deem it unnecessary because we have the expertise to differentiate between what's needed and what's not. And press games and what they're reading on and what they're essentially reading on the internet. Has anybody discussed the potential ramifications of the cost to the healthcare system?
I don't know about that, but I'll tell you that patients have been doing this with Googling stuff for decades. Yeah.
That's fair, but
It's so much easier.
May I share something from here?
Yeah.
I'm virtually.
accurate.
Hi, Doctor.
Yeah,
Tom, go ahead.
I have seen this machine learning. The trajectory of how much they learn is going very fast. So I have a different take on this. First of all, anything that can be read out by algorithm eventually gonna get replaced by using the machine learning, like the question that was asked if about testing and things like that. I really think that certain way of people order the test eventually might get different recommendation. If the test was not appropriate, the machine can tell you what test you should order, or something is not appropriate, it might get rejected. It's already been done in the health insurance industry to bypass certain process like prior authorization and things like that. But I think for us, it's going to change the way we learn and the way we process the information. And I don't know that we're gonna see the change drastically in my career lifetime, but I'm sure it's gonna affect you all, like the younger ones that think that Simpson might be too old.
Yeah, I really think this is coming, and we're just gonna have to adapt to it. I'm hoping it helps us more than harms us. So I'm looking at it from that side, that hopefully it gives us quick information and helps us with documentation, ordering, and all of that, like how EMRs did it. But the EMRs have their own problems too, and all the time, like that's spent on them. But they probably improve care.
I think for households, probably a lot of it's gonna be a way to try to generate more revenue.
Yeah.
For example, billing coding. Replace a lot of billing coders and just have the machine do it, or maybe even let the other administrators, or maybe even infection prevention, like you were just saying, the scope thing. Probably stuff like that where a lot of the investment's gonna go. And probably somehow be able to know how to increase RVUs, for example, based on your HPI, physical exam finals and all the lab, this is what the diagnosis should be, and stuff like that. And so I think that
They start alerting us to things like that.
where it's gonna go, to just increase revenue and cut back a lot of the redundancies and stuff like that.
Then you wonder about the liability. Or if any, so that's why I think it's might not ever replace them, because if ChatGPT makes a mistake, or they gonna go super.
Yeah, I think you're always gonna have to sign on its recommendation.
Yeah, so
And an example of AI used 5 years from now or 10 years from now might be, let's say, radiology. The radiologist won't be replaced, but the radiologist may come in the morning and overnight, the AI assistant has looked at all the films and has said, these are the ones that you need to take a look at, doctor. Start with these first because they have some anomalies. But you're always going to need that human being to take responsibility for the work and to be there as, the ultimate decision-making authority. Because people don't want to talk to the machine. They want to talk to a seasoned infectious disease specialist that they can interact with and that has sort of the ultimate say. That's my.
Yeah, we really hope so. And I definitely think pathology and radiology would be one of the specialties that will go first. Because, I mean, if you can review the films and if you have enough of knowledge to also look at that one line, rewrite it the history, which AI can do, or it can at least get it to the point that you don't need two radiologists. Maybe you need one who just he co-signs all the AI notes. I don't know.
I was about to say, yeah.
I use this with like TB tracing, like contact tracing already, because I think the health department like is able to like use like the genome sequencing and they can actually use the source patient.
Yes. So that one of those applications that was looking at the outbreaks in hospitals was using genome sequencing, and that's how it knew that these two MRSAs were related and not like any other MRSA. Because so they had genome sequencing in that hospital, and this application was using that to detect the same cases, and the same with the Pseudomonas.
Do they use it in the community as well, I'm guessing?
I'm guessing. So some of the drawbacks, I think we've been discussing a lot of it, but it may lead to unemployment. Mistakes are still possible. It's not infallible or anything like that. It makes up stories. I know that New York Times, there was a person a reporter who went ahead and was talking to ChatGPT, and it was like, I don't like my wife anymore and stuff like that. And then ChatGPT started to convince him to leave his wife. Like, and he has it all, and it said a whole article. Yes, and it made a whole persona, and it started to talk to him. We'll be happy together and stuff like that. So there's always it's way.
Aren't they coming up with like a dating apps for bots?
Yeah.
People are falling in love
between bots.
People are falling in love with robots and stuff.
Because
Dad's been married.
when
They're in the for like 20 years.
yeah, because when you give it the ability to basically sift through all this information and have original ideas, original poems, original writing, there's always a risk that it will be affected by some elements of the internet, people who write the conspiracy theories. That's data that's been going into the app as well. It's not that it only gets the good data. The godfather of AI leaves Google and works at danger ahead. So yes, so Geoffrey Hinton here, he basically was one of the first people to work on the precursor for all of this and for AI. And he was lead engineer at Google for a long time, and he just left a few months ago. And he worries that it would cause serious harm, even though he's the one who enabled it. But the reason he's worried right now is he says it was going slowly and securely. People were taking their time to develop the technology. But now when OpenAI released their GPT, everyone is racing. Now it's a race. Who's going to have the best artificial intelligence? Who's going to have the best model for Bing versus Google versus whatever? So now no caution, basically throwing caution to the wind, and they're basically working on this overtime, and that's why he decided to retire. He probably was probably going to retire soon.
I was about to say.
Pretty convenient. But yes, but he's worried that this is truly like if someone's working who worked and enabled this kind of work, leaves and warns about it, I think we should take that in mind. And then you have, I mean, he always has something to say. AI is far more dangerous than nukes. And he did have, I know there was a letter signed by many like tech billionaires and stuff like that and sent to warn that we're going too fast with this. We're not regulating it good enough. I think there's always fear about a new technology or something coming in. People are afraid, people are scared of it. And then you learn how to adapt and work with it. But it definitely has, if you're going to give it all this data, if you're going to give it this processing power and it gets to the point that it's able to do or override the safety things that you've put in, that's scary. And this is where this kind of movie can go. All right. Rise with the machines, and then what's next, right? Or Matrix. It's all like these kind of ideas. They're not very outlandish, and I think the beauty of those kind of movies is that they speak to something that actually could happen, like Contagion talked about, like COVID kind of. And those are my references. Thank you for the discussion.